Our next lecture is lecture number 36, and that has to do also with therapy. Again, we're taking a look at different forms of therapy. We're in that second major category that we call insight-based approaches. And again, our goal is to give you, a little bit of background in some of the major forms of therapy. Again, this is non-exhaustive. List it all in the confines of a survey course. Tough to do that, but again, this should give you, a little bit of a background and something to hang your hat on in terms of your knowledge in this area. So again, the non-biological therapies for behavior disorders, we can group them into insight-based therapies, behavior therapies, and group therapies. And again, that's what we're going to be looking at in this lecture as well as in our next lecture. So insight therapies, this is where we believe that there are unresolved conflicts that an individual has, beliefs that they have that are not really grounded in rational kinds of thinking. So those thoughts, those behaviors are considered to be disordered, and again, that's what we have to work with a particular patient. So let's take a look at a few of these. Certainly, the one that comes to mind is what we call intrapsychic therapy, psychoanalytic therapy, and of course synonymous with the work of Sigmund Freud. So in these types of therapies, the belief is that you can't just treat symptoms. You have to get at the underlying problem, and in order to do that, you have to look into the person's future, and you have to also look into their past. And Freud strongly believed that this form of therapy is really dependent upon two very important techniques. One is transference, in which Freud wanted the patient to treat him as the father figure, and again, this is traditional kinds of psychoanalytic therapy, transference. They wants the patient to really think of the analyst as being a father figure. So there's going to be this emotional connection that's going to develop that's considered to be crucial, for success of this type of therapy. And secondly, this whole idea of free association, that everything you do is represented in conflict. And indeed, there are, a number of different ways of trying to get at this. One is by way of dream interpretation, for example, which has become a major part of this traditional, what we call long-form psychoanalytic therapy. So there's a very specific criteria here, for successful patients. They tend to be bright, they tend to be verbal, they are very motivated to want to participate in these therapeutic sessions. Again, willingness to cooperate. And again, these two techniques of transference and free association are absolutely crucial for traditional, what we call long-form psychoanalytic therapy. Another aspect of this long-form therapy is that it takes a considerable amount of time, with the meetings, sessions usually a couple times a week, can last even years, several years. And so individuals who tend to engage in this kind of long-form therapy, which has become very outmoded, tend to be very wealthy. And again, this psychoanalytic therapy kind of caters to that kind of patient that's really smart. They're very verbal. They're very motivated. They want to cooperate. And let's also add that they're quite wealthy to be able to afford and to engage in this kind of therapy. But again, these techniques of transference and free association are critical. And in free association, this includes dream analysis that, again, even the most minor things that you do sometimes are a product of these deep-seated kinds of conflicts that you are experiencing that, according to psychoanalytic theory, need to be exposed and need to be discussed between the patient and the therapist. When we explore this kind of therapy further, one of the things that we know is that it really works best with individuals that are mildly neurotic. This is something now that has really changed in the field of psychoanalytic therapy, where now you can accomplish pretty much the same things that you do in long form therapy by a shorter form that is relatively intensive, but only maybe a 2-3 week period of time. So indeed, this is an area that has dramatically changed from the long form to short form therapy. But again, there seems to be this criteria for people who are successful that tend to be mildly neurotic patients. When we explore traditional psychoanalytic therapy, I think it's very important to keep in mind that this is not something that's for everyone, that it's a form of therapy that is really gradually diminishing from the field of psychotherapy and insight-based therapies. Whereas at one point it was very popular, it is not something that today is so popular. That it's being replaced slowly by short forms of therapy as well as other types of therapy. Another category here of various insight-based therapies is what we call humanistic therapies, of which probably the most well-known is that of Carl Rogers. You see Carl Rogers here holding a client-centered therapeutic session. And in this, it's really not the patient. It's really not the therapist, but it's the patient that's really directing the therapeutic session. And Carl Rogers, unlike Freud and psychoanalytic therapy, says that he really wants to emphasize the conscious determinants of behavior, not the unconscious determinants. And he wants to help patients get to that ideal state that they want to be in, the ideal state that they want to achieve. So you can mirror the patient. You are there simply to be supportive. Carl Rogers would say it's essential that I give unconditional positive regard to that person. Again, being supportive is absolutely crucial. And again, this works best with individuals that are, mildly neurotic, suffering from anxiety. Another form of therapy that's become very popular is what is called RET, Rational Emotive Therapy, that was developed by Albert Ellis some years ago. And if you take a look at this therapy and you examine what Ellis calls the A, B, C, D of therapy, it's a form of what we call cognitive therapy. We want to try to change the thinking, which oftentimes is irrational. We want to change those thoughts and beliefs, change cognitions. And RET assumes that those thoughts lead to emotions. So the problem really is not the unpleasantness of the emotions, but rather the irrational thoughts that lead to them. So again, let's take a look at this. Let's say you're a student, you get a low exam grade. This is what he calls the activating event. The individual is blocked from achieving a particular goal that they want to achieve. And then what we have is a student starting to say, well, I'll never get through college. And again, these are irrational beliefs. They're interpreting the frustration in an irrational way. And then we have the emotional consequences. They say, well, I'm depressed. So these experiences and these negative feelings, they reinforce those original irrational beliefs that they have. And the job of the therapist is to dispute those irrational beliefs, tell them where they're wrong, remind them that their thinking really is not grounded in reality. Get them to the point where they say, I can do well in college, I just need to study harder. So again, this has become a very popular form of therapy, and RET, again, a form of what we call cognitive therapy. You're trying to change the cognitions of an individual. Another leader in this area of cognitive behavior therapy, again, you frequently just see the acronym CBT, is the psychologist that you see here, Aaron Beck. And again, this is all about allowing individuals to reflect upon their behavior, getting them to become aware of negative behavior patterns. And again, those negative behavior patterns are ones that are serving to support and reinforce distorted thinking. So it helps patients to develop alternative ways of thinking and behaving. This is going to reduce their psychological distress. So again, you have a situation here where someone's saying very negative things about you. You begin making conclusions that you're not a good person, that nobody likes you. That's obviously very negative thinking. You start to get upset and displaying these emotions that are associated with it. You feel sick in your stomach, you feel exhausted. Now you're getting these physical sensations, and this is reflected in behaviors in which you avoid contact with other individuals. So again, what Aaron Beck is saying is that we got to change that awareness of those negative behavior patterns and what is reinforcing it. You have to develop new ways of thinking about yourself, new ways of thinking, new ways of behaving. That's going to reduce psychological distress. So again, that's another important tactic in insight-based therapy. This is really a summary of a analysis that was done several years ago by a very famous British psychiatrist by the name of Hans Eysenck. And he took a look at insight-based therapies and asked the question, are they really that effective? And the study that he did was to take mildly neurotic patients, place them into one of three different groups. One was a group in which they received some form of insight-based treatment. Another group was mildly neurotic patients that received any other form of treatment. Again, that was not insight-based. And then there was a control group that received no treatment at all. And he and his associates examined whether or not these individuals improved. And the way in which they examined this was by way of the therapist's interpretation of symptom removal. That is, are these negative symptoms going away? And here's what he finds. He finds that insight therapeutic treatment, 44% of individuals improved. Any other form of treatment, 64% improved. And if you receive no treatment at all, 72% improved. So what this indicates is that you're better off not receiving insight-based treatment, that you can do just as well by receiving no treatment at all. This is, and again, this was repeated a number of times, and I think that often it's misinterpreted in terms of whether or not, to what extent individuals should engage in this kind of therapy. Insight-based therapies do work, but there's a number of things that need to be considered, about them. Factors that influence this in terms of insight-based therapy, well, they are what we call therapist variables, meaning, how empathetic is the therapist? Do they appear to be genuine? What kind of experience do they actually have in terms of insight-based therapy? Secondly, there are what we call client variables, meaning, there are some problems that individuals have that are more appropriate for insight-based therapy than others. There's also the whole issue of the motivation on the part of the patient. How motivated are they? And then the actual techniques that are used. There are a number of different variations of insight-based therapy. How are they timed? Again, what are those specific techniques? So again, these three variables that you see here are crucial in terms of the success that individuals have in this kind of therapy. So, for example, when we take a look at the patient's view of improvement and satisfaction with insight-based therapy, you see some interesting things. The patient's view of whether or not they felt that their problem improved, 42% say that it helped a lot, 44% said that it helped somewhat. We're talking about 86% of individuals, patients' views that they in fact felt as though their problem improved. If you take a look at how satisfied they were with the therapy, you get 62% who say they were very or completely satisfied. 27% say fairly satisfied. Again, we're talking about close to 90% of individuals who were satisfied in terms of this kind of therapy, which again works best with individuals that are, mildly neurotic. So again, those are, very important statistics that I think help us a great deal to understand how effective these kinds of therapies are. When we take a look at group therapies, we're really saying something very different. We're saying that there's factors that are outside the patient that are responsible for their behavior disorder. So it's a disruption that occurs in terms of social relationships. It really has nothing to do whatsoever with something wrong with an individual's personality or something wrong with them physically in terms of some kind of biological changes that are going on. The best therapy then is to change the person's social environment. Change how that person, how people in that person's environment, how they treat the patient. So again, this is a very different way of looking at things that contrasts obviously a lot with, psychoanalytic kinds of therapeutic usage. If you take a look at the history here, I think it's very interesting. The earliest form of group therapy was in terms of Greek dramas, certainly bull sessions, prayer meetings, revival meetings. These, in the history of group therapy, this was really the forerunner of modern day group therapy. But this really got its start with work that was done in Boston, Massachusetts, with tuberculosis patients. And let me tell you a little bit about that work. It was performed by a physician by the name of J.H. Pratt. He's really considered to be the father of modern group therapy. And he worked with tuberculosis patients who were very depressed, individuals who didn't really understand their disease condition, didn't really understand, how they could get better, if they could get better. And what Pratt did was to bring these patients together in small meetings, usually maybe 10 to 12 of them, in which he would give lectures about healthy living. He would also explain more about tuberculosis, and he would engage them regularly in learning more about tuberculosis and more about how to live a pattern of healthy living in one's life. The patients learned about the disease. They started to support each other more. And became very successful in terms of improving and ultimately beating it. So this was adopted by European psychiatrists, and it was used to treat people that were suffering from similar types of behavior disorders. And again, it became very successful. So this was the forerunner, really, of modern group therapy. And again, it all starts with these tuberculosis patients who are very depressed. So when you take a look at the major current forms of group therapy, things like inspirational group therapy, play group therapy, activity group therapy, family group therapy, encounter group psychodrama, these are all examples of various aspects of group therapy. One individual, Jerome Frank, who also has been a leader in this area, he really believes that all of these different forms of group therapy have a few things in common. He believes that the patients really have to share their inner feelings, they have to share their inner experiences, they have to share their ideas. Again, openness becomes crucial. He also says that everyone has to respect everyone else in these group therapeutic situations. Mutual respect, absolutely crucial. And he says that the goal really is to help a person to get them to respect themselves and give them a deeper understanding about themselves. So he believes very strongly that these characteristics are crucial to success in a group therapeutic situation. So types of group therapies, there's what we call formal groups, where there's one person who's a leader, very well organized in terms of their plan for the group. They want to break down psychological resistance, get individuals to open up. And again, this works well for a number of different patients, like psychotic patients and withdrawn patients, for example. Another type of group therapeutic situation is what we call inspirational groups. This is an area that you're probably a little bit more familiar with, things like Alcoholics Anonymous, for example. The Seventh Step Foundation, which is all about bringing ex-convicts back into normal living. And Weight Watchers. Again, they all use the same kinds of tactics. You have a very strong leader. You have emotional kinds of devices that are used where, I mean, in Weight Watchers, you get weighed in front of other people. And indeed, you typically engage in a lecture by the leader or someone else that's associated with the group, and there's a lot of give and take here that ultimately is going to have that leader sometimes calling out people and helping them really to recognize what their weaknesses are. Who does it work best for? Well, addiction-based disorders, it works incredibly well. Eating disorders, Alcoholics Anonymous, people who are addicted to, very potent drugs of abuse. So again, works very well under those conditions. Another form of group therapy, this is a very interesting one, it's called psychodrama. And it was developed by an Italian psychiatrist by the name of Jacob Moreno. And in this type of therapy, the therapist is the director of a play. And the patients take part in the play. They become the hero or the heroine. And it's a scripted play developed by the therapist. And it takes place on a real stage, and it usually centers around a problem that a patient is having. And there are also what are called actor therapists who get involved in the performance itself. And here you see, one of these plays taking place. And what happens is other individuals who have similar problems watch the play. Okay, they're in the audience, and it helps them. What it does is it really promotes communication. And the audience benefits by seeing, these real problems being acted out on stage, and how those individuals, how those patients went about, trying to resolve their problems. So they can see, the patients that are sitting in the audience can see how this is done. So again, this is called psychodrama. Encounter groups are also popular, and one in particular that I think is used very frequently are marital encounter groups, where a husband and wife would go for maybe a long weekend to a particular site where they would live with other individuals that are suffering from the same problem. They would, over the course of those 3 days, they would all get together, maybe 6 couples, 8 couples or so, and under the guidance of a therapist would talk about the problems that they're having. Because you're living with these individuals over this course of time, maybe a day, maybe a week, maybe longer, you get to know other individuals in terms of the problems that they're having, and it's quite likely that some of the successes or lack of success that they're having in the problems that they have are something that you can benefit from. So again, there's a lot of different encounter groups, but again, one of the best examples is what we call marital encounter groups. So the overall goal of the therapist in this situation is to bring things out in the open, these feelings, get away, strip away defenses, communicate in a very honest fashion. And the success comes from everyone giving support to everybody else. But at the same time, confronting other individuals in terms of their excuses and their faults and their delusions that they have. So again, this is another very popular form of group therapy. So does it work? Well, there are many studies that have been done in this area, and again, summarizing over many of them, a third of people get better, a third of people get worse, a third of people are unchanged. And again, when we're taking a look at things immediately after the group therapeutic situation, roughly 2/3 of individuals, immediately afterwards report that it was a very positive experience for them. You don't get many differences in terms of various types of group therapy in their effectiveness. Traditionally you get this third and a third and a third. So it works best really for individuals like that are maybe encountering stressful kinds of situations in their life. That's who it really seems to work best for. And again, the example of marital group therapy, I think, is a good example of how group therapy can be helpful to an individual. So in our next class, we're going to take a look at, in our next lecture, we're going to take a look at some, the last area, which is various types of behavior therapies that are really based upon our understanding of different types of learning, like classical conditioning and operant conditioning. So that'll be our goal for our next class.